These are my top 7 tips when it comes to giving report. Giving a report is very intimidating at first, and I get it. Trust me, I get it. It is overwhelming, but with time and practice, you are going to get more confident in your abilities to give a solid nursing report. The first thing I recommend is consistency. Find a method of giving a report that works for you and stick with it and practice it that same way every single time. I highly recommend using a good report sheet, especially in the beginning of you learning how to give a good report. This is going to allow you to give report in a very systematic, consistent way. And if you practice consistently every single time, you're going to get more comfortable with the flow. Number 3 is practice beforehand. If you have time and you are able to practice with like a preceptor or another nurse, do it. This gives you the opportunity to, one, practice it out loud before you have to give report to the actual, next nurse that's coming on shift. And it allows the nurse or whoever's listening to you to provide feedback. My 4th tip is to learn the nurses. We're going to learn the nurses that want every single detail in report. You are going to learn the nurse that really doesn't care about report. You're going to learn the nurse that likes to write everything down. You're going to learn the nurse that just likes to listen to a report and doesn't write anything down. As you learn the nurses, you're going to be able to tailor your report to that specific nurse. Number 5 is avoid bias. Reports should be factual and objective information. We should limit the amount of subjective information we are including in report. For example, oh, this patient's spouse is so weird. They're doing some weird stuff in the room. You should see the way that they look at the patient. How is that going to help you take care of the patient? If the information you're giving a report is not going to have any sort of impact on how that next nurse takes care of that patient, leave it out. Which leads me to my 6th tip, and that is to remove unnecessary information. That chest x-ray that was taken 3 weeks ago that was normal probably is not relevant in giving report. We want to stick with information that is current, relevant, and that is going to set that next nurse up for success when they are taking care of the patient. And my last tip is bedside report. I know bedside report is not everybody's cup of tea, but it is evidence-based practice. A true bedside report is where you go in with that nurse that is, either oncoming or offgoing, and you guys do a full report together in the patient's room. So 1, the patient can hear a report and, be involved in their care. And 2, you guys can do a full assessment and safety check together to make sure that the offgoing nurse's assessment is the same as the ongoing nurse's assessment. Now, I understand this doesn't work necessarily for every single patient and situation, especially if you have, 7, 8 plus patients. Even if you can do a modified bedside report version where maybe you're doing a report outside the room and then you go in and do a brief recap and do that assessment and safety check together with the offgoing nurse or